Hello, we're going to talk today about the weight loss process after bariatric surgery, especially gastric sleeve, which is the main procedure that we're performing today for patients with obesity. The weight loss process or the weight loss period after gastric sleeve lasts for about a year. Some patients can still lose weight for about a year and a half, but the first year is the most important period. The weight loss process, the weight loss initiates soon after the operation because the patient is decreasing the size of the intake of calories immediately after the operation. It is a very fast weight loss during the first weeks, and then it slows down, but it will last until the end of the first year. The more careful the patient following instructions and changing eating habits, the better the weight loss. We usually consider that the operation is successful if we get patients with morbid obesity, with a BMI under 40, to get a weight loss of at least 70% of the excess weight. However, every day we're seeing more and more patients with morbid obesity getting to a normal weight with a BMI around 25 after the third year, if they follow the instructions carefully and they have a gastric sleeve performed in the right way. There is a video where we talk about the requirements to make a good gastric sleeve, which would be a thin tube, a complete removal of the upper part of the stomach called the fundus, and a staple line that initiates close to the pylorus, and we do it at 2 centimeters to the pylorus. The weight loss process is fast at the beginning, and after 2 or 3 months, patients will see a decrease in the rhythm of the weight loss, and it will become intermittent. It means that you can have 1 or 2 weeks without losing weight, and then you go back to lose weight. During that time, you're doing the same. You're not eating sweets, you're exercising, and you're following dietitian instructions. So it is normal to have an intermittent weight loss after a few months when you have a gastric sleeve. It is very important that you understand that the first year after a bariatric surgery, and it's mainly after a gastric sleeve, it's very important to be careful following the instructions of the dietitian and making changes in the eating habit in order to have a good weight loss. The main things you should change are avoiding the consumption of sugar, no sweets at all, no honey, no fructose, no brown sugar. You should use artificial sweeteners without calories like Splenda, stevia, or others. The second thing, you should avoid drinking alcohol. If you drink alcohol, you're taking a lot of calories that will not make you feel satisfied. That will go down the stomach into the small bowel, and the absorption is going to be complete. And all those calories will make for a decrease in the speed of the weight loss. If you don't eat sugar and you don't drink alcohol and you stay active, your weight loss should be excellent during the first year. It's very important for you to understand that whatever you do well in the first year will be responsible of the final result in the weight loss. If you exercise, and we recommend patients to start exercising at 1 month, you're going to have a better weight loss, you're going to have a better adaptation to the period of weight loss, you're going to keep your muscle mass, and your functional and aesthetic result is going to be better. If after 1 year you have an occasional consumption of sweet or an occasional consumption of alcohol, probably nothing is going to happen with your weight if you're exercising. But you have to be very careful not going back to your previous habits or eating sweets a lot or drinking a lot of alcohol, because even with a very good operation, you can regain weight. Gastric sleeve is going to give you the opportunity to lose a lot of weight and stay healthy for years. But you have to make some changes in your eating habits, and those changes should be permanent if you want to have permanent results. Thank you.